Hello.
Participants, participants, please note to mute your mic.
Okay. Can I continue?
Yes, sir. Continue, sir.
Okay. So in visual communication, that was about this I was talking. So make whatever visual aids you are using in your communication. Sometimes we use the whiteboards. So it's to show how your situations, your thoughts, or your consequence, or your emotions, feelings related. So that we can draw this and we can show this. But this should be clear and easy to understand. Then the written, if you follow, if you use certain files or something like that, written communications. This strive for simplicity. Don't rely on long and take time to review your written communications. This is one of the advantage that you get in the second sessions. First sessions, actually, we are getting some informations. If you return this information, this will be very helpful for you to conduct the next session. So these are the different types of communications and we use in our communication process. And the second one I mentioned about uh, active listening. This is our ability to focus completely on a speaker, understand his or her message, comprehend the information, and respond thoughtfully. So, in this active listening, here we have certain verbal and non-verbal active listening skills. So the active listening, which is the act of hearing a speaker without retaining their message. This is highly valued interpersonal communication skills. This ensures that you are able to engage and later recall specific details without needing information repeated. So, in this active listening, the verbal active listening, that means this include paraphrasing. Paraphrasing, have you heard about this? That is restructuring the words or sentences. What the client says, we are restructuring or rearranging the words and we are repeating this to the client. That means summarize the main points of the message of the speaker shared to show you fully understand their meaning. So this will also give the speaker an opportunity to clarify vague informations or expand their messages. For example, if a client says that I feel bad or I feel sad. So, some people, they are doing parroting, not paraphrasing. Then, oh, you feel sad? I am weak. Oh, you're weak? So these are just parroting. But paraphrasing means rearranging the word. I feel sad. So we can say, oh, I understand. Your mood is bad, right? Then we can come to the point, what type of mood he is. So he said sad or she said sad. So paraphrasing is very important. So this will, I mentioned you, this will give the speaker an opportunity to clarify vague information. So usually in counseling, paraphrasing is very important. Then ask open-ended questions. Our technique is questioning is one of the technique we are using. Questioning technique. Here there are two types of questions like open-ended questions and closed type of questions. Closed type of questions, that is yes or no type of questions. Here they have the client feel the limitations. Either he has to respond yes or no. But if you ask open-ended questions, certain things we have to clarify. Sometimes we have to uh, get more information about a particular problem. So here, ask questions that show you have gathered essence of what they have shared and guide them into sharing additional information. So here you have to make sure that the questions cannot be answered with simple yes or no. They have to give you a detailed explanation. For example, you are asking the client, you mentioned that you have a problem with a problem at your family. Could you explain more? What type of problems you are facing there? So here we are providing an opportunity to the client to explain or describe this more. And we must ask some specific probing questions as well. This ask direct questions that guide the reader to provide more details about the information they have shared or narrow down a broad subject or topic. So you mentioned about the family problems. Here, your problem is with whom? Family problems, there are so many people. But if he says that is with the wife or husband, that is the specific probing questions. So you must ask this kind of specific probing questions. Then use short verbal affirmations. That's a kind of positive statements. This will help the speaker feel more comfortable and show you are engaged and able to process the information they are providing. That's right. Yes, I see. Oh, I understand. Oh, yes, that makes sense. I agree. So these are the type of verbal affirmations. This is also very vital in listening skills. Then display empathy. Empathy, you know that we are standing in the position of the client and seeing the problem or analyzing the problem. So here you make sure the speaker understand you are able to recognize their emotions and share their feelings. This you can express by showing compassion just rather than showing the feeling. Here you are able to connect with the speaker and begin establishing a sense of mutual trust. Because trustworthiness is one of the important things that is maintaining the relationship with the client. So that we will discuss later. And the next one, share similar experiences. That means personal disclosures. Sometimes we in our life we also would have faced these kind of situations that you can share with the client, especially when you are discussing comparable situations. For example, a client is talking about the unemployment and the issues related to unemployment. Once we all are also faced this kind of situations, so we know how an unemployment person he feels. So you can explain your personal experiences to this client, how successfully you handle that situation. So this also help you to build a good relationship with the client. And if the speaker has shared a problem, providing input on how you solve similar challenges is valuable to the clients. And next one, recall previously shared information. That means you should try to remember the key concepts or ideas or other critical points the speaker has shared with you in the past. That means in the first session. That's why I mentioned you. You have to write it down, all the important messages or important points he shared with you in your first meeting. So you can use that in the second situation or the second session. This demonstrates you are not only listening to what they are saying currently, but you are able to retain information and recall specific details. Like, last week you mentioned about your work stress, and we discussed something about your work stress. Do you want to add something more to this session? So here, that is motivating the client to share his current feelings about his work or relationship in work situations. So these are the verbal listening skills and non-verbal listening skills. Nod, nodding head. This is offering the speaker a few simple nods so you understand what they are saying. That's why, even in the classrooms, you are attending the lecturing classes, you'll be nodding your head. So a nod is very helpful. It's a supportive cue. Do you understand? So this will help the client to, or it will work like a motivation. So actually, this nodding is a kind of feedback we are giving to the client that we are listening to you. So that increases the motivation to share experiences. And the second one, your smile. Nowadays we all forget to smile. We use smileys instead of smiling. So please smile to your client, especially when they talk about their problems, when you are listening to them. Here many people they misunderstand hearing and listening. Sometimes okay, you tell I'm hearing. Hearing is different than listening. Hearing, only hearing to these ears and letting away to another ear. That is hearing. But listening, hearing, this comes and we are comprehending, understanding this. So it is storing into memory. So that is the difference between listening and hearing. So your smile, it's just like a nod. The small smiles encourage a speaker to continue. And a smile can take the place of a short verbal affirmation like, yes, I understand your feelings or I understand you more. So this verbal affirmation in helping to diffuse any tension and ensure the speaker feels comfortable. And the most important, avoid distracting moments. Just before someone switch on their microphone and it was creating noises. So because of that, I had to stop my talk. This situation you don't create in front of your client. So avoid all the voluntary moments, like just glancing at your watch or taking the mobile phone and scratching it. And some people, to listening, because this is a profession, you are right from morning till evening, you are listening different clients. Sometimes you feel physically exhausted. Some people, if they this kind of audible sighing, actually next time the client will not turn around to this situation, to never they come back to you. And some people, they're taking their pen and playing with the pen, opening, closing, or hitting or tapping a pen. These are actually distracting moments, or even some people in a open their drawers and searching something. Okay, okay, you tell, I'm listening. Actually, these will be distracting. So avoid all the voluntary moments like just I mentioned, like looking at your watch or phone. So this indicate that you are busy or time is running out. Better you stop. So here you also avoid exchanging verbal and non-verbal communication. So these kind of distracting moments that really create a feeling of frustration and uncomfortable. So maximum avoid that. Then maintain eye to eye contact. Whenever possible, keep your eyes on speaker and avoiding look at other people or objects in the room. So this also maintaining eye to eye contact, that's a non-verbal cue. You are listening to the client. So your gaze is natural. Don't be artificial. A natural gaze. There is a difference between gaze and eye contact. Gaze means looking at the face, but eye to eye contact maintaining the looking at the eyes of the client. So these are the verbal and non-verbal active listening skills. Now let us come to the observation skills. So observation skills actually refer to the ability to use all 5 of your senses to recognize, analyze, and recall your surroundings. Now, what is happening there? And observation can help psychologists understand how someone feels, even when they don't express those feelings verbally. So that's why we say that action speaks louder than words. No need to use the words. Your actions, your behavior, your body language will explain what you are experiencing. So, the practice of observation, this also associated with the mindfulness. Mindfulness, our full attention and concentration to someone or something we are doing. This encourages you to be present and aware of the details of your daily life as well. So that's why observation is becoming very important. So that means all our sense organs should be open. Next is the problem solving. Usually people seek psychologists for help solving mental or behavioral problems. Without problem, no one will come to you. But you have to understand that where there is a problem, there is a solution. Without solution, there is no problem in this world. But the time or the way we find a solution, that making our life more miserable. So these clients, actually they don't know how to solve these issues. That's why they are coming to you. So you have to help them to find a solution for their problem. So here your academic backgrounds or your research experiences, this can help you to find a good solution for the client. So that's why when we conduct research, we develop the research questions that they want to solve, which can help educate and support the general populations. More specifically, if I say, psychologists may need to use their psychological knowledge and various perspectives to create appropriate treatment plans or your intervention program. So you can also develop multiple solutions so that if one doesn't work, they can move on to another. Because sometimes, sometimes two people may have the same problems, but the same intervention may not be helpful to them. So we have to analyze, understand, then we have to use an effective intervention. The next one is research, the importance of research. Most of the psychologists, once they started their career, very few are involving in research activities. The research is very important. That no need to, you have to go and research under a gate. Your clinical data you can collect. Then you can use the statistical methods to analyze it. Then you can predict, oh, these types of factors related to a particular disease or a particular psychological problems. So here, an analytical mind is on that thrives in research psychology. And it is crucial to be familiar with contemporary research methods, as well as to learn how to handle the unexpected and know how to set up any experiments ethically. Now, why I mention about this? You might have studied about J.B. Watson's experiment related to the little Albert. In his conditioning, he conditioned that child to fear rats and other animals, but never sensitized him to the psychological effects and phobias associated. If we conduct this experiment today, you will be liable to answer to our judiciary, because someone can sue against you. That time ethicality was not important, but today the situation is changed. So you should have a working knowledge of the American Psychological Association's evidence-based practice guidelines in order to remain compliant and provide the best care possible. So that means the therapist should have a working knowledge. So what the American Psychological Association's evidence-based practice, you should understand this. So even if you developed a particular method by your research, your own research, if you invented some intervention programs, you have to publicize that. Then only this become an evidence-based practice. So certain things are applicable to some people. If you do not have a research evidence with that, it is unethical. So that's why I always suggest the practitioners, you must involve in research activities. And once you involve research activity, you should have the knowledge on data literacy. This is especially notable among what skills are needed to be a clinical psychologist who conducts research. This is not only applicable for the clinical psychologist, but some of the data are mainly focusing on clinical psychologists. That's why I mentioned here. So you can collect data depending on your desired field. You need a handle on statistics and ability to interpret and summarize large attachments of data. You understand? And they should also be able to find and evaluate other research effectively. And you can determine what is needed for practice or research. So here comes the information. That means in some cases, this involves basic statistical procedures and the equations. Other times it involves in the uh, depth observation methods. So that means this data you have to analyze. That is analysis. The effective psychologists gain significant knowledge about human behaviors and the theories behind it. That's why we are learning so many theories related to learning, motivation, or perception, memory, intelligence. So here they need analytical skills to break down this complex idea into principles that they can use to evaluate, diagnose, or treat individuals. Actually, I think you are building these skills during your education. That's why you are conducting experiments in laboratory, or you are interpreting the psychological research, etc. And another one is critical thinking. This enables psychologists to interpret information to make decisions. For example, they ask questions to determine whether a treatment is most appropriate option. And they realize that even if an effective for an individual in a similar situation, other patients may require a different solutions. Do you understand? So this critical thinking also helps psychologists evaluate, research, and analyze patients' conditions more thoroughly. So that is why if you use this critical thinking, you can understand that one technique you are using to one client may not be applicable for another one because they are coming from different situations. So many factors can be affecting their problems. So when you taking with patients, they may not always get the full story. They trust the patient's feelings, whether they have valid feelings. And you can ask probing questions to gain further information, to collect further information. And the next one is that is organization. Having organizational skills can help psychologists conduct their job more efficiently and accurately. So this is also related to psychologists in research. Those collect significant amounts of data or information which they must organize for further analysis and report findings. And next we come to certain qualities a psychologist should have. Mainly this is related to trustworthiness, empathy, patience, and emotional intelligence. I know you all are know about this, but just I mention you only. Trust, trustworthiness, we can say that it is defined by a psychologist's ethical core. Their ability to accept and conceal confessions that are sensitive while also knowing to protect someone's health and safety. Actually, these are like confessions. This should not reveal. So that's why in the beginning of opening statements, in our counseling process, the opening statement, we mentioned this that the information you are providing to me, this will be confidential. Because this trustworthiness motivating the client to give you more and more information. Sometimes this will be very sensitive type of information. So it is imperative for psychologists to to practice confidentiality. So you must practice confidentiality with your patients. Unless they trust you, they become very defensive or they create resistance. They never reveal important information to you. Now, sometimes this will be a shocking information for you. So here you have to understand this empathetically. Here the role comes empathy. This might be better described simply as warmth. If a psychological fails to demonstrate empathy, trustworthiness will follow suit in being lost. You cannot maintain this relationship because if you don't demonstrate empathy, this affects the trustworthiness. Client will not trust you. So you should understand this in their position, the client's position. Certainly, it means to be able to place yourself in the shoes of others. That means your clients. But it is necessary to communicate acceptance to a client. Now, sometimes a rapist he brought from for suppose the prison, he is sent to you. So you know that a rapist is sitting in front of you. How do you handle if it is a female counselor? Yeah, will you accept the client or you reject? Oh, no, I cannot handle this. So that means we have to accept the clients, whatever problems we have. But here, if you show this empathy, they create trust on you, they communicate to you. In that circumstance, the client should feel listened to and not judged, especially as it pertains to cultural backgrounds or religious practices and gender or sexual identities. Now, sometimes a client, he or she may be a lesbian or a homosexual. So that is why, in the beginning, I told you, we have certain basic knowledge about all those things. Then only we can be empathetic to these clients. So here psychologists should focus on clients on narratives and limit comparisons with themselves to avoid transference. So if you become too much empathetic, that can create transference as well. But if a psychologist fails to demonstrate empathy, trustworthiness will be affected. And when we come to the patients, actually, some people ask me, when I was working in the hospital and I was working in the special education field, that time, I never saw a smiling face. All people are coming with problems, crying in front of us. That's why even now I'll tell my children, don't cry in front of me. I will not feel anything. Because sometimes, this creating deep personalization on therapist. Because every day we are seeing this. That's why I changed this profession to teaching. So I can see many young and energetic smiling faces every day. So because it's not lack of patience, but to a certain point we'll be stagnated. So some psychologists are very disappointed because the psychologist may work with patients for significant amount of time, as they try to resolve issues, because it is one of their responsibility to track patients' progress towards specific goals. But unfortunately, if change doesn't occur immediately, then what happens? We lose our patients. So here you have to be patient. Then you can work with new techniques or solutions into their daily lives. And the last one I would like to share you, that is the emotional intelligence. That's the ability to understand and manage one's own emotions. Here the role of a psychologist, and the role can be emotionally demanding. You know that certain clients, if they after you meeting certain clients, even you cannot sleep. So you need to maintain your mental well-being. As a psychologist, it is applicable for us. That's why sometimes we have peer counseling. There's some topics, because some topics raised by the patients could be disturbing or upsetting. So you must be aware of your emotions and keep them separate from your professional duties. So that's why, when I was working in the hospitals, my wife used to tell me that remove your psychology cot outside, then enter into the room. So because a lot of problems or issues, the clients are coming to us not for time passing. They are coming with so many upsetting and disturbing informations. So let it there. So you have to effectively handle your own emotions. And you can see that part of emotional intelligence is knowing how to react appropriately to others. So you must ensure your reactions maintain a positive relationship with your patients and create a comfortable atmosphere. In conclusion, I can say that whatever skills, knowledge, or qualities you possess, unless you should have a positive attitude, you cannot be a good psychologist. So attitude is very, very important. Thank you. Hello.
Okay, thank you, sir. It's time for discussion right now. You can choose the raise the hand option and ask your doubt.
So if you have any questions, you can just type.
Okay, so that means we don't have any doubts. It was a crystal clear session, sir. Wonderful session indeed. Thank you so much for your valuable time. Thank you so much, sir.
Thank you. Thank you. Yeah, yeah. Actually, it's not crying. Crying means don't allow them to cry because with unnecessary silly matters. They have to face life situations. Because I am seeing very, very complicated clients, and with a silly problem when they come and cry in front of me, I usually say that you cannot influence me in this way. Be bold and face situations. Thank you, Vranta, asking these questions.
Do we have any more questions? Okay, that marks the end of the session. Thank you so much, sir, and thank you for everyone for joining. Thank you so much.
Thank you. Thank you. Bye bye.